I'd like to welcome you once again to our series of COVID-19 webinars. These weekly webinars focus on gathering to share knowledge, experience and expertise. They cover many professional, practical and evidence-based aspects of managing occupational safety and health during this pandemic. Today's session is the 7th in our series, and this Irish webinar is brought to you in collaboration with key bodies, businesses and professionals concerned with the global logistics and distribution supply chains, ensuring everyone everywhere has access to products in the supermarkets and essential retail outlets, as well as helping businesses continue to operate during these challenging times to get their goods to market. For us, our concern is the health, safety and well-being of the millions of key workers striving to continue to enable these supply chains to operate. So in the next hour, we'll examine the complex role of safety and health professionals supporting national and global efforts by these organisations in keeping the supply chains going safely, responsibly and sustainably. The logistics and distribution sector has played a vital part in helping our businesses navigate through lockdown and will play a vital part in helping it recover too. It's essential to ensure that we can maintain this safely as we look to increase capacity and move to the next phases of work during the pandemic. These operations are pivotal in supplying the things we need to sustain our lives and our livelihoods. And there are many challenges faced just to ensure the products we expect to reach our shelves are actually there. Governments globally recognise domestic and international freight providers as essential services. And this poses strong health and safety responsibilities for all organisations connected with freight transport, running transport terminals, warehouses and distribution centres. We'll explain the additional challenges the COVID-19 pandemic is causing and the mitigations being put in place. IOSH members worldwide continue to lead the way in enabling businesses and organisations to respond appropriately during this crisis. They continue to protect colleagues and prevent ill health, as well as helping millions of workers adapt to new ways of working and new challenges. I'm really proud of how our profession is responding right now. I'm delighted today to be joined by a panel of experienced OSH professionals from this sector. So let me introduce to you our presenters and their topics. First, from A.P. Moller - Maersk, an integrated container logistics company with a dedicated team of over 76,000, operating in 130 countries, shipping more than 12 million containers annually and handling a further 40 million containers through their global portfolio of 78 terminals. We're very pleased to welcome its Vice President and Head of Corporate Safety, Kevin Furness. Then Chris Newson, HSS Product Development and Delivery Lead from Make UK, the champions of British manufacturing and manufacturers. Chris is going to tell us how its members are responding in the context of COVID-19 to ensure products can be produced and delivered. Next, Andrew Mawson will provide guidance on driver welfare and the challenges faced. Andrew is Chair of the Irish Logistics and Retail Group and Head of SHEC and DGSA at Bibby Distribution Limited, which operates from over 1.25 million square feet of warehousing space in more than 40 UK locations and employing over 1,500 people. And then our final contributor is Jodie Lynch, Regional Health, Safety and Environment Advisor at Usen Logistics UK Limited, part of a global enterprise in ocean, sea, air and land freight. Its UK arm employs about 1,800 employees, offering complete supply chain solutions across many sectors. So Jodie's going to be presenting challenges faced in depots and key measures to be put in place. Our speakers today provide us with real experiences on the ground, especially on the continuing challenges faced by professionals and the emerging recommendations. After our presentations, our panel will have time to answer some of your questions, so please take this opportunity to submit them throughout the webinar, and we'll address as many as we can. I want to emphasise that this and our other webinars are a platform to inform and engage with safety and health professionals and others responsible for safety and health at work. We want to support you with this regular platform for engagement. This is a two-way channel, giving you the opportunity to share support and guidance on this evolving issue wherever you are in the world and whichever industry sector you work in. Now, more than ever, organisations need authoritative, useful, relevant advice and guidance on managing the safety and health of their workforces. Please visit IOSH's website for the continuously updated COVID-19 advice and guidance that we're producing for the OSH profession. and all organisations on managing the response, keeping staff safe and healthy at work. At the end of the presentations, we'll then run through the questions you posted throughout the session. So, let me welcome first from AP Moller Maersk, Kevin Furness. Kevin, please go ahead and share your screen.
Thanks, Andrew. Okay. I think it's a very interesting time that we're all operating in this particular sector, and for AP Moller Maersk more than many, we were at the very front of this because our issues really started, I guess, before Christmas last year, when we first noticed from our operations in China that things were starting to murmur about disruption and potential disruptions early into 2020 and obviously around the what would be the upcoming Chinese New Year. So with operations, as Andrew said, are in 130 countries, you start to get concerned about how you're going to be able to get these goods and services and food, generally deliveries that come from all around the world into your supermarkets and our supermarkets. And we're at the very front of that, both on the sea and getting it to the places where the major distribution hubs are within the UK, within the world, within wherever you are. And the first thing that I'll say is that we operate not only on the ocean, but in logistics and services, in terminals and in manufacturing and everything else. So we're a very large organization. And one of the things that we had as a prior experience that we unfortunately had a cyber attack back in 2017, which basically forced us into a similar position we find ourselves in today with almost a new working arrangements, new normal that we'd never experienced before. But when we look at this, particularly from the impact on our people, then it became obvious very quickly that we were dealing with something that was very people-centric and not just business-centric. So the first thing our CEO did almost on day one was say, look, the only three things that matter to all 77,000 people in our organization are these three, in this particular order. One, make sure that all our people are safe. Then serve our customers to keep the goods moving, to keep the food in the supermarkets and the PPE and all the anti-bac and everything else that we need to actually fight this pandemic. And then finally, with whatever time and resources we have left, we must support the communities in which we operate, because all our people come from those communities. What I want to do is take you through a little bit, very quickly, in terms of what this means for the people who were actually on board our ships at the time when the world went into this new situation. You know, in terms of China and where we started, and as the pandemic has flushed through the world almost from east to west, let's say, then what we found increasingly was that our crews aboard these vessels who were bringing the goods and transporting them were unable to get off the ships. Crew changes became impossible. People then, borders closed, countries closed, ports closed, immigration stopped, visas stopped happening. And then we got people stranded, almost imprisoned upon floating vessels around the world, not knowing how they were going to get off when their crew, when their term ended, when their network, where the vessel was going to go next, whether they were going to get new food. Because if you remember, a lot of these sailors, they spend a lot of time aboard vessels. They don't go home like you and I do. They actually live, work, eat and sleep aboard those vessels. And when they land at port, they expect new supplies to come in, for garbage and refuse to be taken off, to actually almost get off the vessel to get some downtime. That became almost impossible. So the challenges for them almost became one of stress and even more mental health issues in relation to, when am I going to actually get some respite from this virus, and what's happening with my family? And that put extra stresses onto all our crews, and different challenges that beyond day to day we started to see. And then the network issues started to come in beyond that. We couldn't call at various countries, and then they were stopped. And so people started to really understand that I'm actually going to be aboard this ship for a long time. So getting support and help to them. Fatigue became a new issue because people would not sleep. The stresses that kept them awake meant that they were bypassing issues and mandatory rest breaks in order just to try and keep busy, to take their mind off the issue that was at hand. It wasn't just the people at sea that we had trouble supporting. Almost overnight, we found that 45,000 people in our organization across the world were asked to not go into the office in whatever country you were in. So the pressure then on our virtual network, on our private network, became significant. to move an whole organization that is sales driven out of Asia, out of Mumbai and out of Panama in the US states, to actually take calls from people who wanted to make bookings, made it very difficult. All of a sudden, those people that worked together and provided that service to our customers and to people inquiring when they were going to get their food, their PPE, their vaccines, everything else that they were looking for, their medical supplies, all those people were then having to work remote, and they'd never been in that position before. To shut down those call centers, those service centers, was huge, because we had no idea how this was going to impact them. But our CEO was absolutely clear. He placed expectations on every leader to communicate about what productivity meant in this new way of working, that nobody was expected to be 100% effective, that it was okay to be 60, 70% effective, to actually understand that there was a new work-life integration that was needed, that it wasn't just about work-life balance. Our inland business also suffered. We had then problems with how do people come to work? We can't get people to work. There's no transport. But then goods need to get through. We weren't classed as key workers. Then in a lot of countries, it was confusion and chaos. Our customers saying, we can't move products. How can you help us? So we had to find new ways of working with our teams, with our people, that actually brought us together in a much stronger logistics and supply chain community, helping each other. The relationships that we had as customer and supplier were gone. We were partners. We were working to achieve a common goal of feeding and supporting the world, which made a huge difference to what we thought about in terms of risk and what we thought about in terms of how we shared support and resources. If you think about the ports and terminals in which we operate, then we invite over 100,000 external truckers into our world every day. That's inviting interactions that normally people could shut out. If we wanted to get goods, products to the people, to the hospitals, to the communities in which they were needed, we were going to have to find a new normal, a new way of working and keeping our people safe in line with our CEO's message. That meant we had to throw away almost all of our old ideas around what our operation needed to look like. We had to be agile. We had to be resilient. We had to be flexible. We had to reduce bureaucracy. We had to make it about the people in the real world at the real time, at the right time, and empower our people to make the right decision. That took a hell of a lot of trust in our whole leadership organization to do that, to say, you guys make the decisions what you want to do in the very local areas. What I will say is that there are some things that we've learned. There's things that we've learned about our leadership and what we want to actually hang on to. The first thing is, was not about leading from a business perspective. First and foremost, it was about leading with even more care than our values demand of what it is to work at A.P. Moller - Maersk. Asking what our people needed, not telling them what they could and couldn't do. It was totally about even more engagement. We couldn't get enough. Our people couldn't get enough. And it wasn't about what's happening with me. It was talking to people about a lot of other things, a lot of different things that was just around what's happening with my life. And that became a leader's responsibility. Doing what's right, reducing bureaucracy, and allowing those local decisions became key. There are some things that we want to hang on to, which is harness more of this ability to work in an agile way, to build and realign safety as part of resilience and not part of operations. To work harder on achieving what we've started in this building psychologically safe working environment. It's okay to say I'm not okay and I need some help. Whereas before, our industry has been extremely sort of masochistic in its approach to saying I'm a rough, tough guy working in a port, or I'm a seafarer, I can cope. And we've had to encourage people to open up more. That's been a huge challenge. And that has meant that we've had to provide even more support through our employee assistance programs, through our engagement programs, just through understanding where people are and recognizing that these people who are stuck at sea, who are stuck in terminals, who cannot go home, they're the real hidden heroes in all the supply chain that get the goods, get the food, get the actual PPE, and get the medical equipment that's needed to fight this global pandemic. We're very pleased and proud to be able to support it, and I hope that very short presentation has given you a flavour of some of the challenges and some of the risks that we've actually managed in a different way across Maersk. Andrew, thank you for the opportunity.
Thank you, Kevin, for that excellent start. So let's now turn to Chris Newson from Make UK. Welcome, Chris. Would you please share your screen?
Thank you, Andrew. Okay, so hopefully you can see my screen.
We can, thank you.
Okay. As Andrew said, my name's Chris Newson. I work for Make UK. So if you haven't come across Make UK before, we are a member organisation supporting UK manufacturing, and that's important to understand in the context of what I'm going to talk about today. So I'm going to take you through, in a very short presentation, challenges that our members have faced and solutions or ways in which we've helped them. So just to give, I know there are many people on the webinar today, not from the UK, but just in terms of context, I just wanted to say a few things here. We know that many sites have temporarily closed during the pandemic and are now starting to reopen. That is really following on from the UK government guidance that was released on the 11th of May that talks about coming back to work safely if you can. I will, just after I finished here, pop a link to that into the chat box. You might find it interesting. It's all helpful stuff. It doesn't really matter if you're in the UK or not. When this guidance was released, our membership came back to us very quickly with some questions. I'm not going to go through the detailed content here, but there were 8 common themes, or even 8 common sections, and you can read them on the screen there. I'm not going to talk about them all, and they're things that you would expect to see, I think. The key thing about this, and what we had to explain to some of our members, is that this is the duty is on the employer to make sure these things are in place. The government are there, bodies like ourselves are there to help and support, but the duty is on the employer to put these things into place. And that brought out the question, well, you know, it's very complicated, it's quite a big set of guidance. Where do I start? And to answer that question, and I'll share with you what we shared with them, I really want to really elaborate on 2 specific questions or 2 specific areas here. In answer to the question, where do I start? Well, always good to start at number 1. So it's about thinking about risk. Now here's something on the screen that hopefully isn't a surprise to you or something new. This is the basic steps to risk assessment. You might have different steps. You might have 6 steps, 7 steps, but they're all very similar. And what I wanted to talk about here was, where do I start? The answer to that question is with an assessment of the risks in your business. And what we've helped our members to understand through providing templates and helpful, more detailed guidance is around this process. And so when we talk about identifying hazards, we're not talking about just saying COVID-19 is the hazard. It's more specific than that. You can break it down into smaller parts. The next question is incredibly important. Who can be harmed and how? In the government guidance, it talks about different classifications of people. There are people that have to self-isolate. There are people that are vulnerable because of pre-existing medical conditions. And we have to treat all of those people differently. And again, it is the employer's responsibility. We've had a lot of questions around, well, how do I check people's condition and how they are? Well, that requirement hasn't changed. The employer's job is to check. Now, I'm not talking about temperature checks or that sort of detail, but at least asking the employees to update you with their current condition, current status, if you like. We then go on to evaluate risk. I'm not going to spend any time on that. Use whatever scoring system you like, but don't reinvent the wheel. If you've got a 5x5 matrix, keep the same thing. Much more important than that, I think, is record. Now, I'm not talking about writing it down for some legal reason. I'm talking about writing it down and recording it because you've got to share it. There's no point in doing this if you're not going to show it to everyone. And what I'm going to go on to talk about is something that we've started to call the culture of confidence. The biggest challenge that we hear from our members is that, well, my employees are scared to come back to work. There's a fear. There are lots of reasons why they might not come back, but fear am I going to be looked after? Am I going to be safe is at the top. So sharing what you've done in terms of risk assessment is critical. And finally, and obviously, the review cycle. This crisis, as we all know, changes almost every day. You must make sure your assessments and everything you do is in line with the current thinking of whoever you are getting your advice from. And that might be your local government or someone else. So that's risk assessment, step one. I'm going to go right to the end and talk about workforce management. I'm not going to talk about social distancing. We've all heard lots about that. What I am going to talk about is workforce management. And if I elaborate a bit more on that culture of confidence, the biggest reason, the biggest challenge we're finding with our members is that people are scared of coming back to work. So for us, it's about instilling a culture of confidence. And I think that's got 4 parts. The first one is what I've called, or what we've called, competence and control. You must have someone in your organisation that A, has read the relevant, the local guidance to you, and has the competence to put in place control measures based on that. A health and safety, a sustainability professional perhaps is the right person to do this, a risk manager, but there must be someone that's read the guidance and interpreted it into controls. You've then got to tell all your people about it. And one of the key things we found here is if they haven't yet returned to work, if during the crisis, if you've shut down and people are at home or wherever, it's about giving them that confidence. So it's communicating with them prior to them coming to work, whether that's through e-learning or briefings or virtual classroom training. There are lots of ways to do that. Then we've got regular communication. Again, there are 2 reasons for this. Things change, so you've got to keep people up to date. But it is also, as Kevin talked about, we're operating as a family, a group. It's making sure that your employees are aware that their safety is your priority, and that regular communication around that. And finally, and I think we have to talk about this, I talked about the controls that you're going to put in place, whether they are social distancing, sanitizing and cleaning, whatever they might be. You're going to have a set of rules. Those rules are non-negotiable, and you've got to make people aware. You've got to tell people what they are, but you've got to enforce them. And for obvious reasons, they're there for a reason, so that's pretty obvious. Almost more important than that is if you don't enforce the rules, they become not really rules, and therefore other people that see people not, or the rules not being enforced, the culture you have can deteriorate very quickly and people can just start not to follow the rules that are there. So enforcement is critical. And part of that enforcement is making sure everyone knows why those rules are there. And I'm talking about supervisors, managers, whatever it might be. And this 4-step model here is a cycle. It just keeps going around. You've got to keep things under review, and you've got to keep enforcing things. The very final thing I wanted to say is just another thing we found with our members is they've put things on hold. We can't do training because people are at home. We can't help people with their CPD if they're professionals. And this slide's just about reminding people that there are lots of ways. Our business, as an example, has moved about 6 months in terms of services we provide in a space where it would normally take about 2 years. There's lots of options out there in terms of being able to train people. They don't need to be at work to do it, and all of that, whether that's a competency message or whether it's trying to give them the confidence to come back to work, anything is possible. Technology is moving at a huge rate to support what people are trying to do. Okay, thank you very much for listening. I hope that's been useful. I'll pass back to Andrew now.
Excellent. Thank you very much, Chris, for your presentation. Let's keep moving. Next up is Andrew Mawson from Bibby Distribution Limited. Andrew, please go ahead and share your screen.
Thanks, Andrew. Thanks for the opportunity. Hopefully my technology... Oh, there we go. Everybody see that all right?
Yeah, we can see it.
Brilliant. So just a quick slide at the front, and thanks for listening. This is just to explain that Bibby Distribution is part of a wider family of well over 5,000 employees, and we were met very early on with questions around how we would look after our driver team, make sure they were safe, because most of our work is retail based. So we knew from the start via our CEO that most of our driver team would stay in work and would continue to deliver. So I'll speak a little bit about what we've learned, the wider view of our business, including our Bibby line group, and the future plans. We started planning, believe it or not, back in February, and the first thing that we did as a team, my safety, health, environment and quality team, was do a risk assessment around what it would mean for our driving colleagues to actually go to other sites, and could we ensure a safe system of work. So we worked with our own driving colleagues. We got information from benchmarking forums within the logistics fraternity to make sure that our risk assessment was fit for purpose, and also to make sure that our drivers were comfortable with what we were going to put in place. A couple of the points that came up straight away on the presentation and key things were, what if I arrive somewhere and somebody might have it? So we worked straight away with all of our partners to say, how can we reduce contact? Perhaps how can we not use paper anymore? Because a lot of our delivery points, our collection points, were still paper-based. I think, as a few of the other contributors have said, this has massively sped up the way that the logistics business looks at paper and not using it, and it's been brilliant. We have also looked at how we address mental health and well-being for our driving colleagues, because there was a lot of concern, not just with perhaps their own mental health and well-being, but that also of their families and their colleagues, in terms of, will I take this home with me? Will I come into contact with something that could potentially affect my family? How do I carry on working, and will I be safe? So we put a lot of work into reassuring them through our own mental health work that we already do, through our own use of the IOSH Managing Health and Wellbeing Programme. We also looked at, and a few of you will recognise this, in the early days it was very difficult to make sure that our colleagues had access to toilets and welfare, and indeed certain service stations weren't open and were refusing access. So we worked with the FTA and the RHA, the local UK bodies for haulage and freight, to make sure that eventually the Public Health England came along and said, no, I'm sorry, you need to make sure these places are open such that our colleagues have got access to toilets and welfare. In the early days as well, the service stations were somewhat reticent about providing food and drink. Thankfully, they do that now. And it's a much better place for our driving colleagues to be in terms of access to. So there were very early risks and challenges. We've learned that we've got to work with our customers to make sure that welfare facilities are fit for purpose. That also includes places where our driving colleagues might wait. Classic examples would be that in the early days, our colleagues would arrive to make deliveries, and they'd be guided to a room with 12 people in, which was no bigger than a very small conference room. So there was very limited ability to create space, create the spacing that we needed. Now, I'm pleased to say that we've learnt to a point where our drivers can actually stay in their vehicle or in an area well away from others. We've also learnt that when we're risk assessing deliveries, we improve the control measures. We already considered the mental health and welfare of our colleagues in terms of what they might face at delivery points, but perhaps weren't strong enough on making sure they had absolutely everything they needed in terms of their PPE, cleaning equipment, things like making sure that within their own vehicle, when they were driving, was there a clean area where they could put their own clothes, an area where they could put uniform. If they had to stay somewhere overnight, was it clean enough? Had we checked on it? Where were they staying? What were the facilities like? All of that now is part of our risk assessments that we and our driving colleagues take out. We also now are very, very aware of the importance of pre-start and post-shift cleaning of our vehicle interiors. It's previously the focus, if you like, would have been on making sure that that truck was fit to work in terms of its oil, in terms of its fuel, etc., and so on. We're now much more positive on making sure that we can say that the interior of that vehicle and the exterior is clean and safe for our colleague to use, which we think is exceptionally important. Wider view, some of the things that the logistics and retail group will look at, we've been chatting on our WhatsApp between us all, particularly around things like safe parking. All of us will have seen on motorways, freeways across much of the world where our truckers don't get access to good overnight parking and could often be in a lay-by or even somewhere like an industrial estate or a delivery point. We are working hard. The logistics and retail group will work hard to try and make sure that there's much more parking available. We've already started speaking to the FTA, the RHA, Public Health England about the facilities that are there for our drivers that will enable them to stay clean, clean the vehicle. Not just that, but give them a sense that their mental health and well-being is looked after whilst they're actually out driving that vehicle. Probably everybody's aware that the availability of drivers has also diminished. It's very difficult to get hold of good drivers. I'm very pleased to say that we've maintained our driver population and indeed in some areas increased it because of the work that we've done in making sure that our driving colleagues are valued, they've got the equipment that they need, they've got the right PPE that can clean their vehicle whenever they want, and making sure, of course, that we talk to our customers about what happens when they get to that point as well. So, as I said, to close really, the important thing for me is that our logistics and retail group, as well as the benchmarking forums, are all looking to help to make sure that we maintain the safety, the mental health, the well-being and the welfare of our drivers. Back to you, Andrew.
Excellent. Thank you, Andrew, for your presentation and the insights that you shared with us. Just a note for our participants, we'll move to questions after the next speaker, so please do raise your questions via the Q&A box at the bottom of your screen, and do let me know who your particular question is for. Okay, so let's move to our final panelist, Jodie Lynch from Usen Logistics UK Limited. Jodie, please go ahead and share your screen now.
Thank you, Angie. Thank you for the opportunity. So I just want to share with you basically how we've managed this crisis basically at Usen and how we've implemented some changes across our sites. If the screen changes. There we go. So firstly, it was really important that we set up the correct steering groups. The COVID-19 steering group that was created with the department heads was pretty much formed as the government announced for people to work from home. The terms of reference for this group basically was to monitor any updates from the government and Public Health England and to communicate the guidance to all our employees through our medical log. And it was important to ensure that any information and guidance was through one source only. And that was so as to not overload people's inboxes with information that could potentially be missed. Equally, any information such as cases was sent to this log, which was monitored also by the group. The BCP was enacted straight away, as you can imagine, and it's still being constantly kept up to date with customers, suppliers, and also our employees. For people with no access to our emails, our MD and our head of HSE attended the sites and did a controlled briefing to all staff members to update them personally and also answer any concerns, which was met with positive feedback. Finally, within that group, there was a creation of the guidance for managers. Some people might have already seen the government guidance that came out this week, and this basically mirrors that. So, but there was more practical ways on how we can implement the changes on our sites. The Ready to Go implementation team, this was formed with site managers a few weeks ago, and that is looking at the guidance and discussing how we can implement that within the sites. Now, with our risk assessment, we have took basically a HACCP approach to this, as you would in a food environment. We know that the hazard is the virus itself, so we focused on kind of task-based scenarios and looking at the critical control points to each area of the sites. Now, we did basically an overarching risk assessment, and that's been adapted to each site because there are different complexities on each site, so we are supporting the sites that way. And then by doing that, we can set the work environment, which I'll just breeze through on the next slide. And again, any information is fed through the COVID-19 steering group medical log, and that is briefed out to all members of the staff at USIM. Our wellness project team also, this was already formed. This provided, we provide information on mental health and wellbeing. There's an employee assistance programme, and there's also additional support on there, which we attached a link to our online payslips so that all employees can actually click on the link, and then it will lead them to a SharePoint page where they can access any information on that, including financial wellbeing as well. So setting the environment, I mean, I'm just kind of piggybacking as well on what Chris mentioned about the confidence. Setting the environment is really important because actually it influences people's behaviour. And when you've got kind of a robust system in place and you've shared that with all your employees, that actually gives people more confidence and reassurance to come back to work and know that actually we've done all that we can to now, as the government guidelines are stated, to make them feel comfortable. So these are some of the things basically that we have done today. Obviously, hand washing and hand sanitising facilities is a major point. We've kind of looked at areas where there's critical areas where we need to add extra fixed portable stations for hand washing, obviously people's workstations, entry and exit points. Also, social distancing markers on the floor. You can use physical barriers, staggered start times. It'd be really good as well to look at kind of the capacity levels in canteens. You know, if you generally can fit 100 people in a canteen area, what is your capacity level to make sure that you can keep the 2 metre distance? That might be reduced to 25, and putting notices up and just letting people know that actually this is the maximum people allowed, and making sure that the chairs and stuff are opposite each other and not, you know, keeping that 2 metre distance. Another thing to consider as well, cleaning stations in certain areas such as search points. Some of our sites are high security. So we've advised that people not carry anything with them, keep them in their lockers, and just make sure that we can get people through the search point in a safe way, and have the relevant markers in place as well, so that social distancing is reinforced there. Shielding particularly has been a change to some of our sites. With driver receptions, we do have perspex screen swaps. Most of the sites did anyway, but for some of the sites that didn't, we've integrated that just for the added protection there. And then where social distancing can't be avoided, you know, such as unloading containers, you know, we've ensured that the same people are working together, wearing face masks, and just keeping as much distance as they can. And it's really unloading containers that we're finding in on our sites at the minute. Just another thing to point out as well, you've got to look at things like first aiders. Accidents still happen at sites, so just making sure that additional PPE is provided for your first aiders, and then updating your policies where necessary. We were looking at this anyway, actually, but if you have got kind of security points on your sites, we are changing our safety footwear to composite footwear, and that just, again, just speeds up the process with, you know, removing that metallic form, which kind of slows the process down going through security checkpoints. Again, some more considerations really that you need to think about as well is fire evacuation drills. We've looked at that. If you are going to be placing restrictions on your sites, so only people can go in certain areas, or you're placing barriers up, it's good to kind of revisit actually the fire risk assessment. Is that going to affect somebody escaping should there be a fire? Also, if you are doing currently surprised fire evacuation drills, it would be better to probably plan and communicate it to all staff, just so that they're aware that this is actually a fire drill and it can be done in a safe manner as well. Potentially additional fire assembly points might be advised for some of your sites. Certainly on our sites, we'll be looking at that. Training requirements, again, that was discussed. You know, we're going to be looking at a lot of online learning to replace the face-to-face groups, or just do very, very small groups just based at their own sites. Challenges at first were definitely the procuring of cleaning, sanitising stuff. We did have products on stock, but again, it was just trying to get hold of that and making sure we've got enough on site. And also people behaviour. So that's something that we are looking at, having a platform to voice concerns so that we can deal with any concerns there and just reinforce that behaviour really. And that is all from me. Thank you very much.
Fantastic. Thank you, Jodie, and to all our contributors today. Now we've got an opportunity to discuss the questions that you, our audience, have already posed. We've got 27 questions currently in our Q&A box. You can ask any other questions as we get the conversation going. So please do drop me a note in the Q&A box and let me know who your question is for. And let me again remind you that IOSH has its own COVID-19 resources page filled with advice and guidance, and this and links to WHO resources, the World Health Organization, will also be included in the post-webinar webpage that we're setting up. So over to you. This is your opportunity to put your questions forward to our speakers. If we run out of time after the webinar, we'll review the remaining questions and share answers and related guidance in our post-webinar page too. So if I can ask each of the panelists now to switch on their video and microphones, and we'll begin the questions. We've got some tough questions here, panelists. We'll start with Kevin Furness, I think. Kevin, a question for you from Gavin Reeve, saying, Kevin, noting from press reports that crew changes are still largely not possible, what's your view of when this might change? How long can crews continue to be safe and effective? And what happens if governments don't relax the rules soon?
I wish I had the answer to that one, to be honest, Andrew. I think, you know, crews can only be aboard for a maximum of 11 months under IMO guidance. So some crews aren't anywhere near that. I mean, we rotate sort of every 11 weeks. Our people so far are, you know, frustrated. They've got over the initial shock. They're very loyal and they're very resilient, and they're dealing with the best of the situations. What I will say is we are working with all governments from all the 130 countries in which we call and operate to understand what their expectation is. And we have agreements in place largely with a number of governments in terms of saying when people have to get off, right, for medical conditions and everything else, and how we deal with the social distancing between port workers that come aboard our vessels. But actually to give an answer when this might happen, I don't know, right? I think as lockdown eases, we're watching the bow wave, sorry for the pun, we're watching the bow wave of shift in terms of how countries are opening up, and that's then being reflected in phase 1, phase 2, phase 3 operations. We are daily working with all our crews across the world, understanding what challenges they've got, where they are, when it's likely, if somebody needs to get off for any particular reason. We're trying our very best. We are managing to do some crew changes now. But in the early days, it was almost like there would be nothing because nobody had an idea of what it looked like. But to give an answer globally that says, when are we going to get into crew changes? Well, let's wait and see, because it's a day-by-day, week-by-week decision, unfortunately, and we don't have the answer. We're just reacting and responding.
Okay, let me hold you there, Kevin. Let me hold you there. I want to pick up on a point that I think you're implying that Ashok Havanavar is raising around psychological risk. Given the challenges that you've outlined there, Kevin, how are you monitoring psychological risk for these people?
Well, we have 44,000 of our seafarers all registered and available through our employee assistance program, and we monitor that on a daily basis in terms of with our provider in terms of how many calls are making. And yesterday, it was just by luck. Yesterday we had the latest update, and there were 2,500 calls just over to our EAP provider in the last month, and all but 2 of those cases, the seafarers were happier, satisfied, and felt better from having that conversation with somebody who wasn't aboard the vessel, i.e. the captain or the chief engineer or their sort of first line of command. And we're happy to talk to somebody that wasn't their family either. Most of those are around just questions about what's going on in the outside world and where they can do it, what they can do. So we do an awful lot. We provide everything. We have the highest quality food aboard that we can provide. We have all our crews have access to gymnasium and facilities and internet. But a lot of it is, it's okay providing all this, but this mental health thing comes down to what the individual stresses are on any person. And it's the captains and masters are going through re-education around listening and understanding what the challenges are from a personal level on a one-to-one basis. And then where they don't feel capable of providing that answer, they have a myriad of mechanisms that they can engage that's 24/7, 365 days a year that we can work with. But again, it's just one of those things. It's up and down every day. You know, it's not been followed the pattern. It's been some days we get more.
Understood, Kevin. I'm sorry to stop you again. We've got a lot of questions and only 9 minutes remaining to get through them all. So I'm going to ask all speakers to give as short an answer as you possibly can. And if you want to offer any additional answers, you can do that in writing. We'll post them on the Coronavirus Resources page. So let's get Chris Newsom from Make UK in the mix here. Chris, there's some questions around contractors. How do you vet if a contractor or subcontractor is doing adequate risk management? Is it about documentation, physical measures? What's on your mind right now?
So to be honest, Andrew, I don't think much has changed really. I would advocate taking the same process. I talked in my presentation about a risk assessment. Contractors must have that same risk assessment. It doesn't matter about the format, the steps, the form, but does it cover, has it got the adequate controls in place? And that should be seen virtually, that's easy to do, way before they come to site. And if it's not adequate, don't let them on site, offer advice if you want to.
Mm-hmm. I want to keep you here for a moment if I can, Chris. Andrew Foster is asking, what about involvement and engagement with trade unions and worker representatives in determining suitable working arrangements?
Sure. So, couple of quick things. When the guidance I talked about was written, there were lots of employers, lots of trade unions, mainly Unite, involved in that. So that was the involvement there. In terms of workplace involvement, again, nothing's changed. We've got lots of regulations around consulting with union representatives. It is now is the time to do that more than ever. And I would just suggest that your unions, whether they're trade union, whether your representatives, whether they're a trade union or not, need to be involved in everything you're doing. Great communication method. Thank you.
Good. Thanks, Chris. Andrew Mawsome, I want to bring you in, please. Linda Ramirez is saying it's great that all foreseeable risks are being addressed so that the drivers are safe. But how are you supervising or enforcing remotely while drivers are on the road? Surely this can be challenging for all organisations, but especially for yours.
It is. It's a great question, actually, and it's one that challenges us literally every week. The important part for us is that we maintain communication between our managers and our drivers, and also my team as well. It's making it available. So we use social media to make sure that there's access for our driving colleagues to let us know what's going on. We actively promote them talking to us. I know it sounds really weird, but we do, just so that we get feedback on how they feel about going to places. And if they've got a concern, then we'll help them to manage it.
Excellent, thanks. Andrew, I want to keep you there. We've got a couple of questions about how you clean vehicles practically at the moment. Can you kind of give us some thoughts on how you do that?
Yeah, we've worked with, believe it or not, a couple of vehicle cleaning stations, as well as some guidance from the actual manufacturers. We're using sprays to make sure that we guide the drivers in how to clean the vehicle before they use it. We're also making sure that we use the right type of wipes, the right type of cleaning materials, and make sure the person doing the cleaning is adequately protected, because we clean the vehicles as well, or we make sure they get cleaned before they go for maintenance and things like that. So there's actually quite a lot that goes into keeping that vehicle clean, in much the same way as colleagues on here might do with their car. It's just thinking about the surfaces that you might touch and making sure, as far as it's reasonably practicable, that you get those clean.
Understood. Thanks. Let's bring Jody into the mix here, because Jody, of course, you've got some logistics challenges there too. So Ishan Husainov had asked a question to Andrew Mawson, but I want to give it to you actually, given that Andrew's just been chatting. Is there a specific pre-use checklist that's been created and covers COVID-19 for your drivers, Jody?
We've not specifically done a pre-use check sheet. What we've done is, again, a risk assessment approach and guidance to what drivers should be doing, and also feedback basically towards if there's any concerns, and then we're dealing with it on a case-by-case basis. As we know, drivers are doing the job every day. They understand who they are potentially in close contact with. We're providing them with the necessary cleaning equipment as well. And again, it's just, it's a new thing for all of us, and we're dealing it really on a day-by-day basis. And the information we get off drivers is really important for us.
Okay, let's stick with you, Jody. I'm looking out of my window here today, and I can see tradesmen and delivery people in small and large delivery vehicles. And there's more than one person in there. And a couple of people are certainly picking up on this with their questions. Kieran Delaney is saying, what's the guidance with regard to people traveling in small vans with colleagues? There seems to be so many mixed messages out there.
Yeah.
On driver passengers wearing face masks? Because clearly you can't physically distance yourself inside a vehicle.
No, and that would definitely be a challenge. So it's definitely something that we would want to seek guidance on. For us at Usen, we only have one driver in each vehicle. We don't have pairs usually. So that hasn't been a challenge for us to date, but we'll definitely be keeping an eye on what the government says, the guidelines around that. Actually, does the job itself need to be done? Is there a different way that it can be approached? And again, that's talking to the customers and dealing with different ways of packaging things, going on different vehicles where they could be clamped off instead of two drivers. So again, it's changing the way we work and what's best to comply really with these guidelines.
Thank you. Andrew, let me bring you back in here. There's some questions around paperwork here. And of course, one of the challenges we always have in health and safety is reducing the amount of paperwork and administration we have. But in a supply chain, paperwork is vital, right? So what's the safe method of handling paperwork for drivers and site offices and delivery locations?
Lots of things have changed in quite a short period of time, and even to the point where electronic delivery means are, similar to your Amazon man that arrives at your door. They're equally at risk, but they now don't ask you to sign anymore. But examples that we can give are the delivery note is now emailed to someone at the delivery point. The checker will offload and check and advise that person that it is done, that individual then can either sign or, well, will sign for the receipt of the delivery, tell the driver that the delivery is correct, or if there's an issue, that gets sorted, and then that can be scanned and emailed back. So it's trying as much as we can. It's not perfect yet, but it's trying as much as we can to eliminate the need for different people to touch that paperwork. Because although we know that the virus doesn't exist for so long on paperwork, cardboard, etc., and so on, minimising that risk is what it's all about, and if possible, not doing it at all. So things have changed in the way that we deal with paperwork enormously.
I'm getting very close to the end of our time. I'm going to ask each of the speakers just for a very, very fast answer to a question. My question is simply this. Of all the things that are happening right now in your organizations, what one thing has popped up for you that you've learned from and thought, we need to keep doing this post-pandemic? So I'd like you to think about that question for a moment. While you're thinking, I want to get Chris Newson in for one final question. Chris, I want us to think a little bit about home working, because lots of us have been displaced right now. Do you think in the long term, organizations, large and small, need to be looking at home working being fundamental to their health and safety strategies, rather than just reverting back to old cultures and getting people to come back to the office environment?
I do, Andrew, 100%. I think in lots of ways, and if we just talk about home working, this crisis, this pandemic has made businesses think differently, and there's lots of positive things we can take from that, and the rate of acceleration of these things moving along has been massive. So I think all companies, if it's possible for them to do, should be looking at how they can take things that have had to change and work them into their future strategy.
Good. Thanks, Chris. Audience, you've overwhelmed me again this week with brilliant questions. There's still another 28 questions that we haven't had time to ask our esteemed panelists. So what we'll do is ask them to consider giving us some written notes that we can then post on the IOSH webpage for coronavirus resources and give you some additional guidance there too. So let me get to you then, panelists, please, for your very fast answer, just a few seconds each. Well, one thing have you learned from the coronavirus pandemic that's made you stop and think that you actually want to continue doing this when you get back to whatever the new world looks like post-pandemic? Kevin Furness, let's start with you.
I think, Andrew, for us, it's about recognizing that safety is part of the resilience of your organization. And actually, to actually maintain your operations through a crisis like this, safety needs to be part of your resilience program, not your operations program.
Fantastic. Love the sound of that. Thanks, Kevin. Jodie Lynch, how about you?
Well, for me, communication, that is absolutely key. We do communicate anyway, but particularly people who we'll say at the sharp end have really, really appreciated the MD and Amanda, Head of Health and Safety, going out and doing these town halls. So definitely that.
Good. Thanks, Jodie. Andrew Mawson.
I think ultimately everything that everybody said, plus mental health and well-being for our driver workforce, so important, and improving welfare for them, what's available to them out there on the road.
Terrific. Thanks. Chris, do you want to add something to finish us up?
Yeah, just quickly, the use of technology, as I was saying earlier on, everything, it's just pushed us to advance everything. What would normally take years has taken a few months. Things like training, just to pick an example. Let's not just go back to the way it was before. Let's use the things we've learned in improving things going forward.
Great. Thank you. Thank you to all our panelists, Andrew Mawson, Chris Newson, Jodie Lynch, and Kevin Furness. And thanks to you, the audience, for participating today. I'd like to end this session now by saying that we'll send you all a link to the recording of this webinar via email. So please look out for that in your inbox. And in the meantime, as I mentioned earlier, remember this series of webinars takes place every Thursday at 12:30 UK time. So keep an eye on our COVID-19 webinars page on the IOSH website and in other IOSH channels, including LinkedIn and Twitter, for details about the next webinars that are coming up. I wish you all well. Take care of each other. Be well and stay safe. Bye for now.